So my name is Laine Young Walker. I'm a child and adolescent psychiatrist. I identify as she, I'm heterosexual and married. So if I have to be brutally honest, I knew I wanted to be a doctor when I was really little, maybe like 8 or 9. I don't really know why, because no one in my family has ever even gone to college prior to me. I didn't have doctor role models, but I just had a desire to be a physician. And honestly, at that time, it was OBGYN. And so when I entered med school, that was my plan to go into OB. I just so happened to have my OB clerkship in my third year first, and I had psychiatry second. I liked OB. I liked delivering babies. I liked well woman care. I did not like gyne surgeries. And then I started to battle a little bit with myself, knowing that my lifestyle would be crazy busy if I was only doing deliveries. So I just continued to go through my next rotation, which was psychiatry. And then I was on an inpatient adult unit, and every day was amazing. Every day was a day that I went home excited and enthusiastic, and loved it. I loved the entire experience of my third year clerkship. But I'm stubborn, so I kept saying, no, I came here to do OB. That's what I'm going to do. Though I wanted to allow myself the opportunity to see more psych. So I did a few electives in psychiatry, and that experience carried forward with every experience I had. So finally, after an internal struggle and fight with myself, I said psychiatry is where I need to be. And it was. It's just that I'm a little bit bullheaded, and I said one thing, and so I wasn't doing that one thing. And so that's why I think I battled with it. But after I changed and just said decidedly it's psychiatry, my mother said to me, I don't know why you were surprised. In high school, you had like 12 hours of psychology college credit that you took, right? And didn't you like that? So haven't you always really liked that area, mental health, psychology? And I said, yeah, you're right. You're right. I just had to come to terms with it within myself. I am a member, I think, at the fellow level of APA and ACAP. And within ACAP, I have served on some committees in the past. I'm trying to join the women's committee through ACAP now, which will be a new thing. I was on infant mental health before. I also am a member of the American College of Psychiatrists. And in that group, I'm on the membership committee. I've also joined, since I've become a chair, the American Association of Chairs of Psychiatry Departments. And so there are some that I am more active in as far as committees and things, but I try to attend meetings and try to make some sort of impact in each of them. So when I decided to do psychiatry as a third year medical student, immediately I knew it was child psychiatry. And I don't know what drew me to it so much, but I'm very glad that I've done it. There's not been a day that's gone by that I've regretted being a child psychiatrist. I was able to work for 6 years in an outpatient clinic and build a pretty large outpatient panel of patients, and see people grow and form relationships. And it's not just about the med check. It's really more about how you can make an impact on their life, and not just your 30-minute time with them, but the things that you do and engaging with their teacher or their counselor, their parents, to make sure that they're successful. So I always thought I would always do outpatient. But then when I became the division chief and the fellowship director at the university, as a division chief, you're overseeing all clinical services. And we lost a inpatient provider. So I became the inpatient doc for 14 months. And I'd always said I would never do inpatient. I always want to do outpatient. And I loved that. And so I did that for 14 months, and then took more administrative roles and had less clinical time. But I think for me, what I've learned over time, or what I would say, is that there is not a place within child psychiatry that doesn't fulfill my desire to serve and to help kids and families. So there's a mental health crisis in every state in the United States and in the world. It was a concern prior to COVID, and it's worse since then. Increased levels of anxiety and depression, and not enough people to take care of those kids that have those issues. And so then when you dissect that, it being an overall problem for everybody, and then you look at the African American population, where mental health historically in families is not talked about. People just expect it to be something you pull up your bootstraps, you can take care of it. That's all in your head. Really just minimizing mental health as a real issue sometimes in some Black families. And then when someone that is Black wants to find a provider, they can't find anybody that looks like them, and that shies them away from getting help at all. Sometimes they won't see someone who doesn't look like them. So I think that the fact that I am a Black female has been very important for some patients to be able to see someone that looks like them that they can go to for support and help. To be able to go in the community, because I do talks in the community. I'm in a sorority, and so I do things through the sorority and outside of the sorority at church. But to be able to be that face to people that look like me about what mental health is, what concerns you may have, how you address it, not just through a pill, but through different things that you do in your environment and through therapy and things like that. I think that I've probably been able to make an impact in a way that someone who might not look like me going to Second Baptist Church might not have been as well received. So when I went to med school and when I went to residency, my desire was to be an outpatient provider, 40 hours a week, and go home. I had no desire for leadership necessarily, right? I had no, in my mind, I wasn't looking for that. But along the way, opportunities presented themselves. I think that my personality is such that I'm very very organized, task-oriented, driven. And I think people saw that. So opportunities came, and they offered them to me because they thought that I would succeed. The first opportunity that came was to be the assistant fellowship director. Even though I wasn't working for the university, I was working for Compass Health in the community. We had a training relationship. We trained our fellows there. And so the lead of that came to the division chief and said, hey, we'll give Laine 1 day a week to do this, right? And that just led to other things. Me being the assistant fellowship director and doing a good job at it, when the fellowship director, division chief wanted to step down and the new chair came, my name is what came up as a new division chief and fellowship director. And so I did that, and I feel like I did it well. Made changes, was impactful. So then when other things come up, people look at you, right? And so I think it really has been, opportunities have come, not because I always said, oh, I'm going to do that and tried to do it, but because I was in the right place at the right time, because the right people were sponsoring and advocating for me, and they really helped me to move forward. And honestly, I ramble so much, I don't know if I answered your question, but hopefully I did. And every step of the way, even prior to residency, so even as a medical student, having an advocate, somebody who will support you, is critical to success at every step of the way. But, as I went into a residency and then started to let people see my character, my motivation, my interests, there were people, I didn't ever go to anybody and say, will you be my mentor? But there were people that reached out to support me, or that I reached out to question, or can you help me with this? Can you help me with that? And it just naturally happened. And so the first one was Dr. Arshad Hussain. Dr. Hussein's from Pakistan. He had done lots and lots of things. He was our training director, and he was our division chief. And he was the one that I think talked to Compass and said, we should have Laine help me. We should have Laine work with me. And that was because he saw, as I went through that fellowship, my drive and my desire. We were all chief fellows. There were 3 of us in our second year, and we split it 4 months each. And then it was up to each of us to make that role the best it could be. And I envisioned, he didn't ever tell me this, that he saw what I was doing with that And then he then advocated for me to be in the next role. And honestly, when the new chair came, he and others really advocated for me to be the division chief. So I think it's important. Not everybody will like you, and sometimes there are people that are sponsoring you that you don't even know. They're saying your name in meetings and saying, "Well, so and so should think about doing this," and there are people that are your kind of advisors that actually you spend time with and talk to, and they give you suggestions and tips. Um, and then there's maybe mentors who you're leading and following. I'm sorry. There's lots of various levels of support, but none of us, even though some of us may think we get there on our own, none of us gets to the next step without some of those players. So I'll say this now: when I came as division chief, I very much wanted for the fellowship program to have more training in early child. Because when I was a fellow, we actually went to a child care center and we did some observation, and then we had kind of assessment. We had parents there. We gave feedback. It was a whole team. It was occupational therapy, it's psychiatry. I think there was a social worker, and money caused that to end. So I had a desire to bring something like that back to the fellowship. And my chair was very, very open with me and said, okay, you got to find the money to make it happen. And so I applied for, he connected me with grant writers, and they started looking for different opportunities. I had never wrote a grant in my life. And one day they called me and they said, hey, we think there's this perfect grant for what you want. It's really collaborative. It's launched through SAMHSA, Linking Actions for Unmet Needs in Children's Health. It's due in 10 days. I said, 10 days? They said, yeah. They said, we can do it. You help us with the clinical piece. We'll do the rest. We'll do it. We wrote that grant. We got that grant in 2010. And that grant opened up so many opportunities for our community and for me. So from that grant, which was $3.25 million for 5 years, looking at early child, 5 different areas, developmental screenings, integration of primary care and behavioral health, home visitation, mental health consultation, and a 5th I never remember. And it required connecting with the community, which I had already done as an outpatient provider. I mean, people knew me because I called them. I called the teacher. I called the counselor. And so when I pulled them together and said, this is a grant opportunity, I would love for us to get it. But even if we don't get it, let's try to work better together for early child mental health. I had about 15 people in the room, and they all raised their hand and said yes. And when we got that grant, they all came to our monthly, meetings that we had, and they helped to build this program for our community. And so then as that money was winding down, the children's mental health tax was on the ballot in Boone County. And so we had many people that had lobbied, including my team, to try to get it on the ballot. It got on the ballot, it passed, which meant that there's money now in Boone County since 2015 for kids' mental health. The things that I started with Launch and the team I built, believe it or not, there's 3 of them still working with me in 2023, and we started in 2010 through different funding streams. So that at this point, I think we have about 6 early child and child programs in the community with various funding, including federal funding from SAMHSA for a trauma initiative, county funding, HRSA funding for our Access Project. I have, I think, 20 people doing all of these programs, and it's not my chair thing. I mean, I'm fine about the chair thing. I like it. I think I'm doing a lot. But what I'm most proud of is the growth that we have with all these programs. I think we bring in we just got some funding from DESE for like $6.6 million for a year to do some discipline coaching and training of childcare providers across the whole state of Missouri. So what I'm most proud of is all of these things, and it's an alphabet soup if I told you all of them, that we are doing that have really enhanced the lives of children and families in Boone County and in the state of Missouri, not just Boone County. So one of the things that had I not done, I wouldn't be where I'm at, is I was open to possibilities. When people said, what about, I didn't say no. We started to try to figure out how to make it happen. When I wanted an access project like MCPAP, the Massachusetts Access Project for Kids in Missouri. And I worked for Department of Mental Health at that time, part-time, while I was seeing patients full-time. And I went to the medical director and he said, well, we don't have any money for that. And then somebody else came from NAMI and said the same thing. And he said, oh, we don't have any money for that. And I said to that person, why don't they said, we're going to form a behavioral health task force. I said, I want to be on that task force. And from then to now, we have an access project that started in 2018 that serves over 604 primary care providers in the state of Missouri. So it's be open to the possibilities, and the door may shut, but that doesn't mean it's shut for good. That means it's shut for the moment. There's been multiple things that I've wanted or tried that didn't work, but I haven't given up on them because the opportunity may come later. It just may not be the time. Well, I mean, I know that recently there was something, I'm the only one that is my color in the treatment team. The students are typically not Black. The residents aren't. They might be from another country, right? But we were talking about a young Black female who was very resistant to mental health. And I think it was an opportunity for me to educate them on why that could be. She had even spoke to some of the things that I mentioned about family and not believing in it. And so for me to educate them on, this is not a one-off for this kid. This is cultural for the Black community, and it is getting better, but it does still exist. So I'm going to be honest with you, memory is not my strong suit. But the things that I remember in high school, so I lived in the city, and my mother, I had two older siblings, and they had gone to the public schools, and my mother realized my middle child wasn't reading in third grade or was really behind, and they weren't really paying attention to him. So she put them in private school. And then that meant I started in private school. Okay. And so I was bused to pretty much an all white high school. And the one thing that I think led to me getting started on the road was me telling the counselor, I want to be a doctor, and the counselor, not with me out me knowing, set up things for me when he helped me with applications to undergrad, and actually recommended me for a full ride scholarship to Mizzou. I didn't find that out till later. I was like, oh, how did I get this? I didn't apply for this. It's because the counselor at the high school recommended to them that they would offer it to me. And so my journey to medicine would have been stalled if I couldn't get into and pay for college. And my parents were blue collar workers. And so they would have made a way, but it would have been hard. But being able to be honest with people and open and telling them what I wanted to do helped me in that first step for undergrad. And then in undergrad, I met Dr. Ellis Ingram. He's a pathologist who was the advisor of what was then called Blacks in Pursuit of Medicine. So I joined a lot of organizations and I worked in a lab. And he, I think, was really instrumental in connecting me with the recruiter for the med school here and in helping me to make sure I didn't miss out on opportunities. And so I think if I go way back and look at along the way, my success is because of others. It's because others helped me to get to the place I needed to be even before I knew I needed to be there. I'd say no matter what, follow your dreams and don't be defined by other people. If you hit an obstacle or a roadblock, don't let it stop you, because there's ways to get to what you need either over that roadblock or around it. You just got to figure out what's the best way to get there.